Professor Leitch, we've had the highest number of cases in the pandemic, 6 of the highest rates in Europe. And for the first time in this wave, we've got a hospital at capacity. Should we be seriously concerned?
We should be cautious and we should be thoughtful, John, but we shouldn't panic. We've now had 4 days of stable cases. Remember, hospitalisation data, of course, lags the case data. So we were expecting more hospitalisations this week because of the case rates in the previous 10 days or so. But we've now had 4 days of less than 3,000 cases. It's still too high, but we may be over that peak. I really hope we are. In the next few days, data will tell us. We're closely watching the hospitalisation data in Raigmore and elsewhere. Hospitals are managing, but that may have to be at the expense, of course, of people who are waiting on waiting lists for elective surgery. We don't want to have to cancel or postpone because we've had to do that throughout the pandemic. But we're hopeful intensive care is relatively stable and we aren't seeing high numbers of deaths. So this does feel different and vaccination is working.
We have had higher cases even in places like London, Birmingham. Why is that? Why is Scotland been so bad?
If you look at the north of England, they have very similar rates to us. England is big and its case rate is diluted because of relatively low levels and relatively high levels. A few reasons why Scotland's had a difficult few weeks. The Euros, it's not the only reason, and non-football fans shouldn't feel as though they're completely off the hook. But indoor events for the Euros and travel back and forward to London did give us a spike. There isn't any doubt about that, a very young male spike. We've got lower population natural immunity because we've had lower rates of COVID for the bulk of the pandemic. So about 6%, 8%, depending on which survey week you take, about antibody levels in the community. So our vaccination has to do heavier lifting. But the fundamental reason, John, is Delta. It's a nasty variant of a nasty virus.
But is that credible that Delta has been striking other parts of the country, other parts of the UK, and immunity in Scotland, was it really so different from the rest of the UK?
It was significant enough to give us some more numbers. And remember, the history of waves in a pandemic are not told in 10 days. They're told over months. So you have to watch what happens in Spain, for instance, today, where their numbers have soared. Portugal, where their numbers have soared. But other parts of Europe, where their numbers appear stable. So you can't judge over a short period. You have to look over a longer period. If you look at the top 10 local authorities on the UK dashboard, 5 are Scottish, 5 are English. So it depends how you cut the data. But Scotland's numbers are too high. I'm not trying to dodge your question. And everything we do has to be to get that case rate down, get the hospitalisations down and save people's lives.
You said that it may have been because of the fans travelling to the Euros. Should they have been allowed to do that? Is that regretted now?
Well, I think the messaging was pretty clear. Certainly I did on your programme and many others. I told people not to go unless they had somewhere very safe to watch the game or they had a ticket. Of course, if we could look back, but what could you do? Could you ban travel for football fans? I'm not sure that would have worked, John. I think the Tartan Army may well have travelled anyway. We now have to deal with what we've got. Today's pandemic looks as though it is stabilising. Vaccination is working. So the key message to everybody is follow the rules, get tested at least twice a week if you're asymptomatic, and come for that vaccination to one of our drop-in centres.
There is an argument that the gaps between the vaccinations first and second should be reduced. We've heard some suggestion that it should be reduced to 4 weeks. Given the rise in the number of cases, is that not justifiable?
The obvious place to look for the answer to that question is our experts on vaccination. Not to me, in fact. The Joint Committee on Vaccination, who look at our pandemic, the UK pandemic, and they make decisions and choices about our present position. They say the sweet spot for vaccinating for coverage and for safety and for protection is 8 weeks between the doses. And that's what we're doing. If they change that advice, we'll change our programme.
We are seeing restrictions lifted sooner in England and further as well. The population in Scotland is going to see that. How convinced are you that in seeing that, the population will still stick to the guidelines in Scotland?
It's a great question, John. I think the population in Scotland has been very, very good during this pandemic, as it has been across the whole of the UK. We will try and communicate with every fibre of our being, the First Minister and the rest of us, to try and get across why we need to be cautious. One of the things I would tell you is that a 3-week gap allows 3 weeks more second doses. If we're vaccinating 10, 15,000 people a day with second doses, 10 days is 100,000 injections. 20 days is 200,000 injections. And we're hoping those numbers will rise, of course, as we get more people to come for their vaccines. So it's not a huge delay. The present plan is Parliament next week will hear what's to happen on the 19th of July. When it's recalled, the First Minister will receive advice over the weekend. And then a more major opening, all being well, if the data allows, the First Minister will get advice in time for the 9th of August.